Hi everyone, I'm Aditi Janeja. As I'm sure you know, there is a healthcare bill being proposed by the Senate right now that will repeal the ACA, and that's the Affordable Care Act, or Obamacare. And I think people are still kind of confused. There are these numbers being floated around. 22 million Americans are going to lose health care. That's what the Congressional Budget Office said today. And I think people don't really know what that means. And why people will lose their health insurance. So I thought I would try to help and explain that to you. So basically, the people receive health insurance in one of three ways. People receive insurance through their employer. They receive insurance through Medicare or Medicaid. Medicare is what seniors get over the age of 65, and Medicaid is what people who fall below a certain threshold in terms of income receive. Medicaid is also what is used to help support people with disabilities. And finally, people receive health insurance by buying it on the insurance market. They privately buy it. So for the first category of people, what the Senate healthcare bill will change is the same thing as what the House, the HCA, or what people were calling Trump Care, would change, which is that it will not require your employer to provide you with health care. So employers can make a decision to no longer provide employees with health care. For the second portion, for Medicare or Medicaid, that's actually where the biggest cuts are coming from in the Senate bill. They're saying about 15 million people will lose insurance because Medicaid will be shrinking. As people have pointed out, this is something Republicans have wanted to do for a long time. As people have also pointed out, this was something Donald Trump explicitly said he would not do on the campaign trail. So basically what happened under the ACA with Medicaid was that it not only provided people with Medicaid who were already getting it, but it also allowed for an expansion. So it allowed states to choose to accept federal money, free money from the federal government, so that more people could get Medicaid. So it was, if you're usually it's if you're below a certain percentage of the poverty line, this raised that percentage. So it's like this is the poverty line, it's actually a little bit higher than that. And the idea was that the poverty line is not the best measure of whether people can actually afford to purchase health care out of pocket. And so what we're going to do is we're going to raise that so more people are eligible for Medicaid. When you talk to people who are on Medicaid, most people actually really like their insurance and the fact that they have access to doctors and health care. For people with disabilities, it provides supports that they need to live in their community, things like their wheelchairs, their home health care assistants, things that are actually a lot less expensive than being institutionalized. So before this community support was available, people with disabilities, more serious disabilities, were forced to live in institutions because Medicaid was required to cover people who live inside nursing homes. So this would actually probably raise costs, I think, for people with disabilities. I haven't looked at the numbers there, so I'm not quite sure. But my guess is for people with severe disabilities, it would raise costs if you reinstitutionalize them as opposed to funding for them to live in communities and be able to work, etc. But there's also other groups of people who would be deeply impacted by cuts to Medicaid, including kids. So lots of kids are covered by Medicaid. 1 out of 2 every births are covered by Medicaid. So lots of people would be deeply impacted by cuts to Medicaid. Basically, the difference between the House and the Senate bill is the House bill says that the expansions would end in 2020, and the Senate bill actually only continues the expansions for 3 years. So it would begin to roll it back instead in 2021. And so the idea there, I'm guessing, is something linked to the elections in 2020. In regards to coverage for pre-existing conditions. So because this bill is being passed through what's known as budget reconciliation, it's harder to change rules or provisions that are actually just law. So under the HCA, which is the House version of the healthcare repeal bill, maybe they could have cut pre-existing conditions, but it seems like it would still be difficult. Under the Senate version, it's also complicated and maybe not allowed, but there are ways to restructure the private insurance that insurers could provide if you're buying it privately so that you get skimpier coverage in states that get waivers for essential health benefits. And what essential health benefits are, basically, Obamacare required every healthcare plan to cover, I believe it was 10 benefits. And under the House version and the Senate version, states can redefine what those benefits are. They can apply for a waiver, which the federal government can grant to change what those benefits are. Those benefits are things like maternity care, hospital care, prescription drugs, and mental health. So a lot of people who are being helped right now through the opioid crisis or for mental health services are doing that through Medicaid, particularly in rural South. Planned Parenthood funding is also at issue here. Basically, both the House version and the Senate version would freeze federal funds to Planned Parenthood. But right now, there's no line item in the budget where money goes to Planned Parenthood. Basically, what happens is Planned Parenthood gets reimbursed like any other doctor or healthcare provider by Medicaid when someone who has that insurance goes to them and they get reimbursed for it. So this would freeze their ability to receive those funds. It seems odd that they're signaling them out. Federal dollars don't go currently to fund abortion. So what it would really be cutting is access to things like cancer screenings, birth control, wellness exams, breast cancer screenings, things like that. And when I had last looked, when the House version came out, it seemed that there are 15% of people who currently receive services through Planned Parenthood, if I'm not mistaken, don't have access to any other medical care. So there is a portion of the country who, if funds to Planned Parenthood are frozen, would not be able to access any medical care because they live in very isolated rural communities. Both the House and the Senate version will cut taxes for the wealthiest Americans. So basically what you're doing is you're cutting access to healthcare for Americans who can't afford it through Medicaid and basically giving a tax break to really wealthy Americans who don't, in my opinion, need it. And there are also subsidies that were part of the Affordable Care Act, which is for people who are buying insurance privately on the market. And what the House version did that was really odd and that I was very upset about was that it made those subsidies based solely on age. The Senate version goes back to considering age, income, and the communities that you live in, because health insurance in certain parts of the country is a lot more expensive, and also, a poor 25-year-old who has health and care needs, someone like myself just out of law school, would have a lot harder of a time affording healthcare than, maybe a really well-off 40-year-old. So age isn't always the best proxy. So the Senate version does fix that. One of the big problems that you hear people talking about is that are people going to be required to purchase healthcare? And the reason this is a problem is because basically it's like if you think about if you were in a cab, if you were taking a cab somewhere, and if you don't have if there's only one person in the cab, you have to pay the whole fare. But if there are like 5 people in the cab, well, that doesn't quite work, but maybe like 4 people in the cab, and then you can split the fare amongst you. So it's really important that there are healthy people in the market to split the cost so that it's cheaper for everyone, including the healthy people when they eventually do need health care. What the HCA did, the House version of the bill, did was it said that if you re-enter the market after not being in the market, health insurance companies could surcharge you. They could charge you extra because you had left the market. What the Senate version does is basically say that if you leave the health insurance market, if you don't have insurance, you're not allowed to reapply for insurance for 6 months. And the idea there is they're trying to encourage people to stay in and not leave the market. To me, this seems a little bit silly because usually people don't stop getting their health insurance because they don't want it anymore. They usually stop getting it because they can't afford it anymore. And so basically what this does is punish those people further by saying, hey, well, if your circumstances change, you get reemployed, you find a job, whatever it is, you can't buy insurance for another 6 months. In all versions of this, the House version and the Senate version, you can stay on your parents' insurance until you're 26. And I think that's about it. So really what it looks like is the Senate wants to vote on this coming week. And there have been rumblings that basically say House members would pass the Senate version if they were able to get it through, and they would stay, and they would also try to pass it within, next week. So this is happening now. We know that the president would likely sign a version of this, and the CBO estimates are that 15 million people will lose health insurance if the Senate version passes next year, and 22 million people will lose it by 2026. That is slightly better than the House version. The House version estimated 23 million people would lose it, so it's like this much better compared to the current version. It's, I think, relatively atrocious. And I just say, outside of the policy, on a personal note, to me, it makes me feel, as a person who needs healthcare to live and to survive, and to be functional and to provide information like this for you, that senators just don't see us as people, that they don't care who we are. I've always worked for the government. Every job I've ever had, every internship I've ever had, I was working for the government, and it makes me feel like they just don't care about people like me. And if that was the reason that you voted for this president, because you felt like that in the past, this doesn't seem to be an improvement, and I'm really sorry for that, because I think we all wanted an improvement. And that's obviously not what we got. Whether some of us expected it or didn't is a different story. But what we can all do now, regardless of how we voted in the past, is we can call our members of Congress and try to influence them and ask for a change. And I really do believe that your voice does matter, and you should be heard. And even if it ends up not changing your representative's mind, you'll at least have the peace of mind of knowing that you did what you could. And so I encourage you to call your representatives. Thank you so much.